The disparities are coming mostly from a technological perspective and in how we can use data to uncover missed opportunities in HIV testing, diagnosis, and care, using data from link data sources, so combining electronic health records with other data sources, Medicare, Medicaid, data claims, housing, and mental health data services. Uh, we have gaps already between urban and rural that are very stark, in the type of data that is available, how it can be accessed, how it can be used, what it can be used for. Um, the power inherent in data science, which is what I do with machine learning, is the ability to do predictive analytics into the future, and help kind of bring things to the forefront so that we can address them early. So, for example, um, looking at who's at risk for not remaining in HIV treatment so that providers can use more resources to reach those populations. Um, Looking at where people with HIV are most likely to seek care, so we can strengthen the systems around where they come to seek care, so it's more welcoming and ready to take them on. Looking at data to see communities that are vulnerable to changes either in supply chain, for uh, the drugs, or changes in policy, or different other things. So we're not reactive, but we're proactive. Um, and that's from even from the state departments of health to standalone health systems. So we can have and support an equitable resource allocations. So we see in the South, for example, we have rural counties that are affected. They don't have PrEP providers. They don't have access to care like urban counties, high uninsurance rates, um, high STI rates, both in urban and rural, but urban have more access to resources to take care of those things. And then you bring the context of social determinants of health into play. So transient housing, homelessness, instability around that. You got the underlying factor of substance use. So while we've done as well as we can with opioid disorder, but it's just been another exchange in terms of substances. So now we've got new substances, we've got synthetic substances. Then you got mental health that has been an underlying challenge, regardless of whether you're living with HIV or not living with HIV. And again, rural, um, minority populations suffer the impact of this a lot more. And then finally, around this issues, there are already established syndemics, where you have disease conditions that interplay that already exist, and the impact differs depending on how vulnerable that individual is. So we have the opportunities to look at those vulnerabilities and those most vulnerable populations, so we can intervene again as quickly as we can or we should. If we can make everything we do with AI or data science translational for the patient, you can see the actual benefits. So, for example, we are working on an algorithm right now, where the algorithm takes historical data and looks at it and is able to predict the risk of a patient failing treatment or having what we call viral bleeps, where you have a high number of viruses in the body of the um, individual. And we can leverage data in that sense to aid the providers such that when the person living with HIV sits in front of them, they have access to latent information and hidden information that will help them, one, prescribe the right treatment, from the range of antiretrovirals that we have, or two, also alert them to the risk of this individual being among a high cluster of patients most likely to fail treatment. If we're able to do that, we will improve the treatment and the outcomes for people with HIV significantly. We'll also use that to reduce the gap between those who have and those who don't, because some of those knowledge bases are typically concentrated in the urban centers or the academic health centers, when overlaying such a simple clinical decision support tool across any EHR electronic health record system will kind of make sure that we balance or level the playing field. So in a sense, that's a practical example of we should be looking for things that are translatable directly as much as we can to the person living with HIV through their providers or through any of the other support systems that support them.